I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them.
Statins have become one of the most widely prescribed categories of drugs in medical history. And so we know a lot about them.
Dr. Peter Langstjerne has been practicing cardiology since 1985. We asked Dr. Langstjerne to explain how statins work and how statins affect coenzyme Q10 levels within the human body.
They are a drug that blocks a biochemical pathway in all cells. Very high up in the pathway, it blocks the production of a compound called mevalonate. That's the precursor for many other compounds. When you block this pathway, you block the ability of cells to biosynthesize cholesterol. Well, there's many branches on this pathway. Think of it as a tree. And you're cutting it off at the trunk, all the branches will be affected. Not only do you lower cholesterol, you lower other compounds. One of those that we know a lot about is this coenzyme Q. So if you take a statin and you decrease cholesterol levels, let's say by 40 or even 50%, which they're capable of doing, you're going to have a 40 or 50% reduction in CoQ10. It's not avoidable, it's the same pathway. So cells that are active 24 hours a day, every day, very active, and that would be heart muscle cells. They don't rest day or night. They use a huge amount of energy, and therefore heart muscle has the highest concentration of CoQ10, by far.
We have the unfortunate effect, therefore, that by giving a statin to try and reduce cholesterol, we may well be blocking one of the most important molecules in the function of heart muscle. So in effect, while statins may be acting, they think, in a good way, we've got very ample evidence that by blocking CoQ10, we are probably raising the risk of heart muscle failure and therefore heart attacks from a different avenue other than arterial blockage.
Most drugs, if they're going to affect you adversely, you can tell it within a day. You swallow the pill and 30 minutes later you throw up or have diarrhea or have a rash, and then you know not to take it again. Statins are insidious because their side effects begin very gradually over a period of months to years.
My experience shows that statin side effects can be very subtle. They can involve other organ systems. They can present themselves months to maybe years after starting the statin, so it's not necessarily within a short time frame. And by that time, usually a patient gets diagnosed as having a whole new disease, and then they're put on a whole new drug.
Okay, so here is a rat experiment. They took rats and they divided them into 4 groups. This is a control rat. This is being CoQ10. This is given CoQ10 plus a cholesterol medicine, and this rat is just being given a cholesterol medicine. And what you do is that you weigh the rat to see their muscle mass. Higher the weight, that means they're forming muscle. You put them on a rat exerciser, it's called rotarod, to see how long they can exercise. And you do certain blood tests to see if there is chemical damage to the muscles from the use of cholesterol reducing medicines. Okay, so this is muscle mass. So in other words, if the muscle mass is going up, the rat is increasing in weight. And this is the control group and the CoQ10 group, they increase their muscle mass. But when you give them cholesterol medicines, at 21 days, their muscle mass is dropping dramatically. Is there evidence of chemical damage from the muscles? If the muscles get damaged, they release certain enzymes in the bloodstream. One of them is called CK, creatinine kinase. This is the group that is given the statin, atorvastatin, and that's the highest amount of muscle damage at both 14 days and 21 days. This is another muscle enzyme which is called myoglobin, which is again released into the bloodstream. The control group and the group that was treated with statin, a 5-fold increase in evidence of muscle damage. Now what about exercise performance? Did it affect the rat exercise performance? So at 14 days, the only group that had reduced exercise performance was the group that was treated with cholesterol medicine. Then the group, and at 21 days, the highest reduction in exercise tolerance was in the statin group, in these rats. What about humans? Is there any evidence in humans? So these are not people with heart disease, these are normal people, 420 of them. They've been given a cholesterol medicine for 6 months. This is assessing muscle damage in terms of activity. They were given an accelerometer, and the more the counts you had, the more active you were. The less the counts you had, the less active you were. And most of us out here are over 50 years of age. So if you were 55 years or greater, the reduction in your activity was dramatic when you were on the cholesterol reducing medicines compared to the placebo group. So there is evidence from research studies in normal people in a 6-month time frame that there is significant reduction in activity when you take a cholesterol medicine. How long do you think people usually take a cholesterol medicine? 1 year, 40 years? Long time. Now we've talked about CoQ10 a lot. The way I talk about CoQ10 is that it is the spark plug of an engine. If the engine doesn't have spark plug, it cannot burn fuel. Similarly, if our mitochondria don't have CoQ10, they cannot create usable energy, which is called ATP, and CoQ10 is a cholesterol byproduct. So my fellow Texan, Dr. Lance Joan, took 10 patients who were on statins. He did muscle biopsies, he did blood work, and he compared them to 9 matched controls. And out in the blue line, what you're seeing is how the matched controls performed. And compared to that blue line, the people who were on statins had higher blood pressure, higher sugars, they had lower CoQ10 in their muscles, they made less enzymes that prevented oxidative damage or free radical damage. They were not able to generate the energy currency because they didn't have CoQ10, and they were insulin resistant. So Dr. Lance Joan took 328 patients that presented to his office and were on statins, and he found that 50 of these patients complained that they were having myalgias, that they were fatigued, that they were having shortness of breath, that they were having memory issues. And he stopped their statins. And when he stopped their statins, majority of them improved. In 28 of these patients, they had heart muscle dysfunction that he evaluated with an ultrasound of the heart called an echocardiogram. When he stopped the statins, 50% of these individuals improved. This is something that was not good information for the statin industry. And what they did is to say, hey, let's go on a fence and say that using statins will prevent mortality in people who have congestive heart failure. Heart failure is a situation in which the heart muscle is not pumping well. So what they did is to compare people who had heart failure who were on statins compared to who were not on statins. And this is an unfair comparison. A proper way to compare is to see the group of people who are on statins, if they are taking statins less frequently, in the middle, or taking it more than 75% of the time, who does better? And that's the comparison I did. So if you were taking statins less frequently, you were less likely to die. In fact, the highest mortality was there in the group that took the statins most of the time. Not just all-cause mortality, you were at greater risk of strokes, you were at greater risks of getting heart attacks.
By Dr. Carl Folkers from the University of Texas in Austin showed us that coenzyme Q10 could actually reverse many cases of congestive heart failure and improve the management of other heart conditions called cardiomyopathies, as well as high blood pressure. Now, Carl Folkers was able to show that biopsy results from the heart tissue of patients with various types of cardiovascular disease showed a coenzyme Q10 deficiency in 50 to 75% of cases. and that when he gave them CoQ10 supplementation, it often led to a dramatic clinical result in patients with various kinds of heart ailments. So how does CoQ10 improve these heart conditions and help prevent them? Well, CoQ10 is required for energy production in the heart muscle. So if there's less CoQ10 in the heart muscle than is optimal, it leads to a power shortage. So the heart pump starts to get weaker. The muscles can't contract with optimal force. That leads to congestive heart failure.
So the name of the study, supplementation with selenium and CoQ10 reduces cardiovascular mortality in elderly with low selenium status, a secondary analysis of a randomized clinical trial. In the 219 individuals that received the selenium supplementation, 200 micrograms, and CoQ10, 200 milligrams for 4 years. 4 years of supplementation with selenium and CoQ10 reduced the risk of death from cardiovascular disease for a 10-year period afterwards. So pretty compelling results.
A paper entitled Statin-Associated Cardiomyopathy, Response to Statin Withdrawal and Administration of Coenzyme Q10. Now in this paper they're postulating this condition known as statin-associated cardiomyopathy. So here's the 3 conclusions that they had in this paper. Now, first, some patients who are receiving long-term statin therapy experience heart failure along with other statin-attributable adverse effects, most of whom respond positively to withdrawal of statin and the addition of CoQ10. Now I've talked about CoQ10 in other places. It is a critical coenzyme in our bodies, and the chemical pathways that statins interfere with also will reduce CoQ10 probably to the same proportion that it'll reduce cholesterol in a person. This SACM, which is statin-associated cardiomyopathy, let's break into those words a little bit. Cardio, heart, myopathy, muscle damage. So statin-associated cardiomyopathy is statin-associated heart muscle damage. And they're suggesting that it may be a factor in the current increasing incidence of heart failure. So while heart attacks may be down, the implication here is that heart failure is up in whatever population they were looking at. The key one to me is that these observations may alert practicing physicians and patients that this condition actually can occur, so they're in a better position to recognize what is otherwise, key phrase right here, gradual and insidious process. And that's what it is. If you were taking statins and after 5 years you had heart failure, what's your doctor likely to say? Wow, you probably would have had heart failure 2 years ago if you weren't on the statins. Or, oh, that's too bad, you're just one of the few people for whom statins didn't prevent this from happening. They probably wouldn't stop to think that maybe the statins caused it. And that's the key finding in this paper, is that it appears that the statins caused the heart failure. We always got to keep that in mind.
미국에 사는 웨인이라는 사람의 이야기입니다. 운동을 아주 좋아하는 웨인은 3개월 전 심한 독감을 앓았습니다. 그 뒤로 몸이 너무 피로하고 뭘 하더라도 금방 지치게 됩니다. 엑스레이를 찍었는데 엑스레이상 심장이 심하게 커져 있었습니다. 심각한 심장 문제가 있을 가능성이 있어서 심장 초음파를 시행했는데 심박출률이 17%가 나왔습니다. 심박출률은 심장이 얼마나 강하게 뛰는지 보는 검사법인데 정상 환자의 심박출률은 약 50에서 70%입니다. 40% 미만을 박출률 저하 심부전으로 분류합니다. 30% 미만으로 떨어지면 심장 이식 가능성을 고려하기 시작합니다. 웨인은 심장 조직의 생검도 시행받았는데 바이러스성 심근병증으로 진단받았습니다. 주치의는 항응고제인 쿠마딘과 심근수축 증강을 위한 몇 가지 약물을 처방했지만 수주 후의 재검사에서 심박출량은 23%로 여전히 비관적이었습니다. 결국 심장 이식 대기자에 명단을 올리게 됩니다. 이식을 기다리는 동안 일상생활 자체도 힘들다고 호소하기 시작합니다. 항산화제와 미네랄 등을 같이 투여하기 시작했고 약물 투여를 통해 심장에 보이는 혈전이 사라지고 불규칙하던 심장박동도 다소 호전되었습니다. 하지만 이게 전부였습니다. 이제 더 이상의 방법은 없었습니다. 기다리는 수밖에 없었죠. 친구이자 의사인 닥터 레이 스트랜드는 더 이상 잃을 것이 없는 친구 웨인에게 이 물질을 투여하기로 결정합니다. 이 물질이 심부전에 효과가 있다는 연구 결과는 이미 많이 나와 있었지만 이를 임상에 적용하는 심장내과 의사는 거의 없었습니다. 물론 지금도 마찬가지 현실이긴 합니다. 그런데 4개월 뒤에 외래를 다시 방문합니다. 그는 놀랍게도 현재 상태는 좋다고 했으며 자전거를 하루에 8km를 탄다고 했고 심지어 살짝 뛰는 것까지 가능하다고 말했습니다. 닥터 레이는 상당히 놀랐습니다. 다시 심초음파 검사를 하는데 심박출률이 놀랍게도 51%까지 회복되었습니다. 수주 후에는 58%까지 회복되는 놀라운 일이 벌어진 겁니다. 웨인은 다시 상근직으로 정상적인 직장 생활로 복귀했습니다. 그리고 수년이 흐른 지금도 큰 불편 없이 심박출률도 정상으로 유지하고 있습니다. 제가 처음 저 이야기를 들었을 때 저는 전혀 믿지 않았습니다. 그냥 저 환자가 특별한 경우일 뿐이라고 생각했죠. 어떻게 심박출률이 17%의 심부전 환자가 58%까지 회복할 수 있다는 말입니까? 이건 의학적 상식에 완전히 위배되는 사건입니다. 하지만 이런 기적 같은 일이 실제로 전 세계적으로 최소 수백 건이 보고되었습니다. 웨인에게만 있었던 일이 아니었던 거죠. 닥터 레이 스트랜드는 자신이 집필한 책에서 웨인의 스토리를 소개했습니다. 그의 책 제목은 당신이 주치의가 영양의학을 모른다면 당신을 죽일 수 있다 라는 다소 섬뜩한 제목입니다. 하지만 웨인의 스토리가 사실이라면 이 말도 충분히 일리가 있는 말일 겁니다. 이번에는 다른 의사가 경험한 사례를 소개합니다. 66세의 루카스는 1989년 심근경색이 발생한 이후로 후유증으로 호흡곤란이 있습니다. 2003년 심장초음파 검사에서는 심박출률이 35%에 불과했습니다. 그런데 계속되는 약물치료에도 불구하고 루카스는 계속 악화됩니다. 그 뒤로 2차례 더 스텐트 시술을 받았고 2006년도에는 심박출률이 15%까지 내려갑니다. 심장의 기능을 거의 못하다 보니 1, 2주에 한 번씩 폐부종, 흉막 삼출 등으로 천자수를 통해 폐에 물을 빼는 시술을 받기 위해서 입퇴원을 반복하게 됩니다. 주치의는 곧 사망할 것으로 판단했습니다. 심장 이식 외에는 대안이 없던 상태에서 피터라는 의학 박사는 루카스에게 이 물질을 하루 450ml씩 투여하기 시작했습니다. 그런데 수개월 뒤에 다시 검사했더니 심박출률이 35%로 크게 회복된 겁니다. 그러자 환자 스스로 900ml까지 증량한 후에 8개월 뒤에는 60%까지 호전되었습니다. 그리고 현재 호흡곤란 등의 자각 증상은 거의 없습니다. 이 환자의 경우는 웨인보다 훨씬 더 드라마틱한 것 같네요. 저도 비슷한 경험이 있습니다. 72세 김정대 씨는 보행이 어려워지고 양하지 저림감이 심해 제 진료실에 내원했습니다. MRI 검사상 중증 척추관 협착증이 진단되었습니다. 척추관 협착증은 척수신경관이 좁아져 신경을 압박하는 병입니다. 보통 보행이 어려워지고 하지의 신경통이 심한 특징이 있습니다. 협착증이 너무 심해서 수술 외에는 전혀 방법이 없을 정도의 상태였습니다. 65세 이상의 고령 환자분들은 수술 전에 보통 심장 초음파 검사를 받습니다. 그런데 심장 초음파 검사에서 심박출률이 38%가 나온 겁니다. 40% 이하인 경우에는 전신 마취가 매우 위험할 수 있기 때문에 수술이 불가능하다고 판단했습니다. 그래서 저는 3개월 동안 이 물질을 하루 300ml를 투여했습니다. 3개월 뒤에 다시 검사했더니 심박출률이 55%까지 회복되어서 무사히 수술을 마칠 수 있었습니다. 그리고 현재까지도 특별한 문제가 없는 상태를 유지하고 있습니다. 조금 전에 생명이 위험했던 루카스 씨를 극적으로 호전시켰던 피터라는 의학 박사는 자신의 사례들을 논문으로 정리했습니다. 논문의 제목은 진행된 말기 우렬성 심부전 환자에서의 이 물질의 투여요법입니다. 피터 박사는 총 7명의 사례를 발표했습니다. 7명에서 이 물질의 혈장 농도는 평균 1.6이었으며 평균 10개월간 이 물질을 투여한 결과 혈장 농도는 6.5까지 올라갔으며 심박출률은 22%에서 39%까지 호전되었습니다. 생명이 꺼져가는 환자들에게 그야말로 엄청난 기적이 일어난 겁니다. 심장 이식을 받지 않으면 단 1, 2년도 생존하기 어려운 심부전 환자들을 이렇게 회복시킬 수 있는 이 기적의 물질은 과연 무엇일까요? 이 기적의 물질은 바로 코엔자임 Q10이었습니다. 지난 영상에서 고혈압 치료에 있어 훌륭한 대안이라고 소개드린 코엔자임 Q10이 바로 오늘의 주인공입니다.
I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them. In the middle of my 2-year illness, I saw my internist for our annual check. After briefly noting that I was seeing several specialists for my dry eye problem, my arrhythmia problem, my colitis problem, and my depression, she then got to the heart of the visit, which was that she was delighted that my cholesterol levels were under control. I find it ironic that neither she nor I ever stopped to question why a relatively young, healthy person had suddenly developed 5 new illnesses in 1 year. And the only new thing in my life was Lipitor.
It's not only possible that GPs aren't reporting adverse effects, it's certain that they aren't. I would think it's likely that about 1 in 200 adverse events are actually reported. Probably less.